different topics that we have prepared. But most importantly, today is Word. We also have World Lymphedema Day today, and we also have World Book Day celebrated in some parts of the world. So very quickly, Perpetua will take us on our first day for today, sixth day in the month of March.
Yes, today is World Lymphedema Day, and this day commemorates it's aimed at raising awareness on the swelling of the body, a health condition that's got to do with the swelling of the body. Now, this is a chronic disease that is characterized by disfiguring soft tissue swelling, also known as edema, in one or more parts of the body, caused by a compromised lymphatic system. Now, at one point or the other in the society, we must have come across people that have swellings in different parts of their body without, a cogent explanation why they have these swellings. Some of them may tell you, okay, I woke up and I saw these swellings in different parts of my body, but most of them do not even know where these swellings are coming from. So if you are, or if you know someone that has this condition, please do not discriminate, do not self-medicate, do well to seek the attention of the medical doctor or go to the hospital for urgent medical care. It could be that there is a disfiguration in your lymphatic system and it needs urgent attention. Now, this day also raises awareness on the importance of avoiding self-medication. Like I said earlier, you may see one or two swellings on your body, and rather than you going to the healthcare center, the health facility to seek help and proper checks, you self-medicate, and then you cause further damage to your system. So please, when you find this kind of swellings in different or any part of the body, it could be that your lymphatic system is faulty and then you need urgent medical attention. So do well to seek that attention. And then for those people that have this disease around you, this is not a time for you to discriminate or look down on them. This is a time for you to encourage them to get medical support and also show them the care and love and support that they need.
Thank you, Perpetua. You said a lot, but I'll tell you, I picked up something very important, and that is self-medication. For me, self-medication is a no-no, but unfortunately, it's been in our society for a very long time, and it has kind of eaten deep into our society. Even in the days when we were children, we found out that many of our parents did self-medication. If you're hot, if you're throwing up, whatever is wrong with you, it's malaria, and they are treating you for malaria. But it's important to know that self-medication is a no-no. I know some persons also like herbal mixtures, but then it's very important to go see your doctor. Make your doctor your best friend. Now, still on World Health Days, today is also Dental Day, Dentist Day, I beg your pardon. Today is also Dentist Day, and it's a day set aside to appreciate all our amazing dentists who do the most to make sure that our teeth stay healthy. Now, it is important to take your dentist visitation very seriously. A lot of people take for granted the need to visit their dentist. Some persons will tell you that they can use traditional things, they can use this leaf or that leaf. Well, I'm not disputing it, because some things might work for some persons, but some things might not work for some persons. But trust me, sometimes when you use these things, when the pain comes back, it comes back double. So it's important that you fix a date with your dentist. Make sure you go on your regular routine dentist checkup. Now, Dentist Day is an annual professional holiday celebrated on March 6th. It is the perfect occasion to express your appreciation and gratitude to the people who help you keep your teeth healthy. This date of March 6th was chosen because presumably on this day in 1790, American dentist John Greenwood, who served as George Washington's personal dentist, invented the first known dental foot engine. Now, Dentist Day celebrates all dental health specialists, including but not limited to regular dental surgeons, orthodontists, periodontists, pediatric dentists, prosthodontists, dental assistants, dental technologists, dental hygienists, and dental therapists. Dentists are typically not the people we look forward to seeing. Yes, I know. But many of us feel nervous before a dental visit, which is very normal, and the men's side of a dental chair makes us anxious. But once the dentist starts work is complete, we really appreciate what they have done to assure the health of our teeth. On Dentist Day, send your dentist a greeting card and congratulate them in person. And if you want to visit the dentist as rarely as possible, start paying more attention to your daily dental care routine. But keep in mind that the regular checkups are still important, even if your teeth seem okay. Now, it is very important to see your dentist, I think at least twice in a year. Well, I'm not a dentist, but we are going to have a dentist who is going to come here to inform us on the importance of keeping our teeth healthy and how often we should go for certain dental procedures like scaling and polishing. Perpetua is smiling because Pepe knows how passionate I am about the dental field. But yes, big shout out to all the dentists out there who make it happen and who make sure that our teeth stay healthy. Remember that a healthy teeth makes you smile wider.
Sure. So
I just feel like I'm giving like a quote right now.
yeah, you just dropped some bars right there. You dropped some bars.
All right. Okay. Pepe, take us on our next day.
All right. The next commemoration or celebration is the World Book Day. Now, this day was established by UNESCO in 1995. It is a global event that focuses on the promotion of reading, which unfortunately is beginning to exit from our today's society. Now, the importance of reading can never be overemphasized. Someone has said that people don't read, and that if you want to put information that no one will be interested in, or the majority will not be interested in, that you should put it in a book. That's to tell you how the spirit of reading is leaving the society. So today's commemoration is talking about bringing back reading, bringing back the culture of reading on our books. This is very, very important. Like, if I can ask people on the set here, how many novels have you read? How many books do you have? Like, books, I'm not talking about soft copy, the one you downloaded online in your phone. It's just few people. That's to tell you that digitalization is taking away the era of filling the pages of an actual book when you read them. So today's commemoration is aimed at informing us and encouraging us to be readers, to read books. You can never have too much books or too many books. The more you read, the more you're informed, the more you know what is going on around you. You may not need that information at that point in time when you're reading the book. You may not want to use the word at that point when you're reading a book. You may not apply one or two situations you've read about from the book at that particular point in time. But one day, all of these things will come in handy. It will make sense when you're conversing. It will make sense when you need to provide information. It will also make sense when you need to apply one or two life skills. So it is important that we buy educative books today, and then we develop a culture of reading. This is very, very important, because reading, unfortunately, is leaving our society. So we need to bring it back. We need to bring it back. We need to read lots of books. This is very, very key.
All right, the important thing, another very important thing that as I get older, I get to know is that reading books can be very therapeutic.
It is.
So you might want to start by getting a book today. I understand the fact that social media has taken away the need to want to read, and then our phones as well, e-books and things like that have taken away the need to want to read in hard copies. But I tell you something, picking up a book to read can be very therapeutic. It could be a spiritual book, it could be an inspirational book, but just pick something. Pick something. Well, you could start by reading a book and sleeping off at some point, but after some time it becomes a culture that you get used to.
Sure.
Well, that's that on World Days. Now, there's been a lot trending today, between yesterday and today, on our political scene. But you know what? We'll take a quick break right now, and we're going to invite our paper analysts who will come here to talk about some of these issues. And then in between, we'll have our paper review. Don't go anywhere. It's still Thursday's edition of Morning Ride. All right, it's still Thursday's edition of Morning Ride, and it's now time for another segment, that is the paper review and the trending issues. With me here, I have our paper guest analyst, Comrade Bonnie Akeze. Good morning, sir.
Good morning.
Good morning, sir.
Welcome.
Good morning.
Welcome.
How you doing?
I'm fine.
All right, I'm fine too. Okay, very quickly, we go straight to our paper review. And today's dailies is quite packed. We have the Guardian newspaper, the Nation newspaper, the New Telegraph newspaper. We have the Daily Times newspaper. We also have the Punch newspaper, we have the Daily Trust newspaper, we have the Vanguard, and we have the Daily Sun newspaper, and lastly, we have the Nigerian Tribune. Perpetual Iboba is also here, very much seated. All right, first we'll take on the Guardian newspaper. And first here, the headline says, First Bank HQ groundbreaking ceremony. Now the picture there speaks for itself. You can see some top officials on that paper right there. Now at the top strip we have there on the Guardian newspaper, we have there First Bank takes first shot at Nigeria's Manhattan's commences 44-story edifice. Okay, you can also see the picture there. I just have to say that's very beautiful. All right, the next story, Pepe.
All right, the next story is the Nation's newspaper with the screaming headline that also says First Bank HQ groundbreaking ceremony. The picture there speaks for itself, and Tinubu, Sanwo-Olu, Lord First Bank on new headquarters take off. That's it on the Nation's newspaper.
All right, the New Telegraph newspaper is next, and the same headline is making on the New Telegraph newspaper that says First Bank HQ groundbreaking ceremony. Now it has riders to that story, and of course you have some top officials who are standing right there taking a photo. At the top there we have LASG approves construction of First Bank's co-friendly headquarters. This and many more you can get on the New Telegraph newspaper.
The Daily Times newspaper is next with the screaming headlines that says, "We are building viable, globally competitive economy." This is coming from the #1 citizen of the Federation, Tinubu. And the next story says, "Sexual harassment allegation. Court stops Senate probe as police disperse pro-Natasha protesters." For details of these and more, you can find them on the Daily Times newspaper.
All right, and now we take on the Daily Punch newspaper, and the headline is still same. That's making waves on the other papers. Says First Bank HQ groundbreaking ceremony. At the top strip there, we have Tinubu lays foundation for First Bank's new eco-friendly HQ. This and many more. Okay, at the bottom there we have sexual harassment. Senate dismisses Natasha's petition. Kogi Senator shuns panel. This is on page 2. For more stories and more information on this, please grab yourself a copy of the Punch newspaper.
The Daily Trust newspaper is next with the screaming headlines that says, "Alleged sexual harassment. Senate dismisses Natasha's petition against Akpabio." And lastly, Funtua battles T.Y. Danjuma and others over 9 Mobile.
All right, the Vanguard, we have here the Vanguard, and first the headline here says Rivers crisis, Amawole assembly, Fubara's commissioners flex muscle. The Vanguard newspaper is really packed, but this one again here says NAFDAC mops up 50 trailer loads of counterfeit drugs, and that's on page 11 of the Vanguard newspaper.
The Daily Sun newspaper is next with a major story that says, Akpabio breaks silence on Akpoti, denies sexual harassment allegation, says mother raised him well. Women plan 1 million man march to demand Senate President's resignation. And then the next story here says, AGF group disagree over proposed expatriate tax policy. For details of these stories and more, please do well to get yourself a copy of the Daily Sun newspaper.
All right, we now take on the Nigerian Tribune, and first on the headline here says First Bank HQ groundbreaking ceremony. At the top there, we have groundbreaking of new HQ. Tinubu Lord First Bank Management Foresight Achievement. This and many more you can get on the Nigerian Tribune. So please do grab yourself a copy. Let's get back to the studio. All right, it's still Thursday's edition of Morning Ride, and with us here is Mr. Bonny Akeze. Welcome again, sir.
Welcome.
All right, okay, Mr. Bonny, as much as I would want to ignore this particular topic, but I just can't. So let's just touch on it a little bit. It says, Akpabio breaks silence on Apoti. Now denies sexual harassment allegation, says mother raised him well. Another writer to that story says women plan 1 million man march to demand Senate President's resignation. This particular story, as I said before, I felt like I should have, scrolled past. But I saw a video that's been making wave on social media where some women were asked, why are you protesting? And they truly don't know why they are protesting. They just know that they should come out and stand by their illustrious son. I want you to touch on this issue. Welcome.
Well, I don't think this is a topic that I'm interested in. And because to me, judging from where we are in Nigeria and what we're facing, these things are just distractions. And like you said, somebody came to protest and they asked him, what are you protesting? He doesn't even know. So it's been that. Most of the time, protests in Nigeria are just, protesters in Nigeria are hired crowd, So, like I said, I think we should just allow them to play their game and we focus on more national issues, things that are beneficial to the generality of the citizens.
Let's take a trip to Rivers State. The crisis happening in Rivers. 19 commissioners who are parading themselves as commissioners, allegedly, but are not commissioners. Touch on this and many more issues that's happening in the Rivers State right now, and what you think should be the lasting solution.
Okay, I'm not aware of the issue of impersonating commissioners, people who are not commissioners and who are claiming to be commissioners. I'm not aware of it. But the issue, the political crisis in Rivers State is just bringing home the facts about our democracy. I have always I've been of the school of thought that we are not yet a democratic society. We may have civil rule, but that culture, that political culture and ideologies that defines democracy, a functional democracy, I don't think we have it. So to that extent, I think the thing in the Rivers State shows us, what is playing out in Rivers State shows us that we have a long way to go. Because when people are going for election, they come to meet the electorates and say, electors, give us your mandate to serve you. But once they get on into power, you see that they behave more like overlords. And nobody remembers that he's a mandate bearer. Seem to remember that he's a mandate bearer anymore. It is me and myself and the powers I think I have. I think we are not going to. It's not a phenomenon that is going to take this country anywhere. We should submit ourselves. In fact, until we have that culture of submitting to the absolute details of the rule of law, we are not going to be counted among the democratic societies. So that is my take on River State.
All right. Okay. So, taking a trip to Vanguard newspaper, it says this one is coming from the minister.
Okay.
The minister says tariff increase will push available generation to 7,000 megawatts. I think when it comes to the issue of the electricity sector, like, what's your take on all of this? Because first off, it was the issue of band A, band B, band C increase and all of that. So what's your take in all of this, actually?
My take in all of this is that I don't know why we are foot dragging in really getting the electricity sector, the power sector, functionally unbundled, functionally decentralized. You know, if you see the discourse, most people, especially big businesses, they have moved on. They have left them behind. People like Dangote, Boa, and many other big electricity consumers, they have gone on their own power generation. They are no longer looking at they are no longer patronizing the public power supply. If you go to the major cities, many estates are no longer hooked on to they have their own independent power. Some turbines, some windmills, some, you know. So, and I think that is workable. Let them continue there holding on to the old, you know. The way to render an idea obsolete is that you bring what it's superior. You bring a superior idea to it. So, even in this Asaba, I know people that are that run their homes on solar power. So the issue of hike and whatever. Well, of course, the cost of running business, the value of the naira, is definitely a thing that is affecting every sector, including the power sector. So, but the issue now is balancing price with disposable income of the consumer, because it is not about you have something to sell. The people you are expected, prospective consumers, do they have the effective demand? The effective demand is demand backed by the power to pay for what you want to buy. So it's a fix, you know. I think it is a matter of time. It's a matter of time, because they say that necessity is the mother of invention. What has the hard economic situation is really pushing everybody to put up their thinking cap. And so if the power sector entrepreneurs and proprietors are not flowing with the current will leave them behind.
All right. Okay. Thank you so much, Mr. Boniakeze.
Thank you so much.
We hope we would have been able to keep you here longer, but it's been an absolute delight having to talk to you, and you've helped us to dissect some of these trending national issues. Thank you very much for coming.
Thank you. It's my pleasure. Thank you.
All right. We've been speaking with Mr. Boniakeze on some issues that have been trending in our national and our political scene. Thank you so much again for coming.
Thank you.
All right, we're going to take on our next part, where we're going to be talking about dental care, and Dr. Bimbo is here with us to tell us the importance of dental care. It's still Thursday's edition of Morning Ride. Don't go anywhere. to Thursday's edition of Morning Ride. Now, you might wonder what dental care is. I'm here to let you know that dental care refers to the practices and habits that helps maintain the health and cleanness of your teeth and mouth. Today, we're going to be talking about the importance of dental care, and with me here, I have Dr. Bimbo Akinuli. He's a principal dental officer at the Federal Medical Center, FMC Asaba. Welcome, sir.
Thank you very much.
How are you doing?
Good morning,
I'm
Dr.
fine.
Okay, so first of all, I have to tell you, happy World Dentist Day.
Yeah, thank you very much.
You're
Thank
welcome.
you very much.
All right, so tell us, who is a dentist?
Okay, thank you for having me this morning.
You're welcome.
First and foremost, a dentist is a oral health practitioner. He heads that team.
Okay.
Okay, because there's what we call a dental team, and it consists of the dentist, the dental technologist, the dental therapist, the dental nurse, and the technician. So a dentist heads that team.
Okay.
A dentist is a health practitioner who has a bachelor of dental surgery
Okay.
in a university.
Okay.
In Nigeria currently there are about 14 universities that studies dentistry.
Okay.
Yeah.
Okay. So tell us, what's the significance of today?
Well, the World Dentist Day was it started in 2013, and the essence is for people to appreciate their dentist, the dental team
Okay.
that helps them take care of their dental problem.
All right.
So the main essence of today is for the population, the patients, to appreciate their dentist.
I'm probably not to stress the dentist today,
Most likely.
because some patients can be stressful. I know that. All right.
Okay.
Okay, so
Okay.
when we talk about dental care, what do we mean, doctor?
My host has already done a very good definition about what dental care is all about. It's the practices that ensures that you take care of your mouth, okay, your teeth, your tongue properly, to ensure that diseases and infections are reduced maximally. Okay, now dentists, we don't just take care of the teeth, but when you hear the word dental, it doesn't just refer to the teeth.
Okay.
Yeah, it has to do with the teeth and the associated structures around the tooth.
Okay.
We're talking about the gums, the tongue, even the face. Because in dentistry, there are about 7 subspecialties in dentistry. That is,
Okay.
after you've had your Bachelor of Dental Surgery from a recognized university and you want to specialize, oral and maxillofacial surgery is part of that specialty.
Okay.
Orthodontist is part of that specialty. And they don't just take care of the teeth, they perform surgery all over the face.
Okay. All right.
Okay.
So we're trying to break this down as much as we can so that people out there can understand. Tell us more about oral hygiene. When is the right time to come in to see your doctor, your dentist? How often should you visit your dentist?
Okay, let me start from the last question. Ideally, it's WHO recommend that you see your dentist twice a year,
Twice a year.
every
Okay.
6 months,
All right.
or it could be less than that depending on your dentist's prescription. But if you've not seen if you're not the type that you saw a dentist for a particular condition, at least twice a year see your dentist.
Okay.
And see your dentist. Then with an oral hygiene, you're expected to brush twice daily
Okay.
with a medium bristle toothbrush,
Okay.
not a hard toothbrush, not a soft toothbrush, but a medium bristle toothbrush, not so hard, not so soft. And then
So those brush they call smoker's brush shouldn't be used,
it shouldn't be used.
even for smokers.
Even for smokers,
Okay.
it shouldn't be used.
Okay.
If a smoker decides to use it, just use it for a while, not something you use every day.
Okay.
And maybe when you notice deposits of dark deposit around you can use it. Then see your dentist immediately.
Okay.
Because those smokers brush, they have a saw-like effect on your tooth.
They're usually like iron sponge.
Yeah, they
Okay.
cut the teeth bit
Alright.
by bit.
Okay.
So it's not recommended.
Okay, then for children, we get that they are teaching a lot of things, different things in schools today. Some children will tell you, my teacher said I should brush 3 times a day. Some will tell you 2 times in a day. What is the actual number of times that a child should brush?
You are expected to brush twice daily.
Okay.
Twice daily. The last thing before you go to bed.
Okay.
That's after meals. And then
Okay.
once you brush, you shouldn't eat again.
Oh, not before meals, after meals.
Yeah, after meals.
Okay.
After meals.
Okay. Why is that?
The reason for that is that after your dinner, you want
Okay.
to take out all the food deficits that remain in your mouth.
Okay.
You want to take it out completely. You want to ensure that nothing is left.
Okay.
Okay, because the bacteria in the oral cavity, they do the most amount of damage at night. At night, when you are still, when there is no salivary activity in your mouth. Now, saliva helps to keeps bacterial activity at bay because it contains what we call an amount of immunoglobulins that help to fight some of these organisms.
Okay.
But at night, there's no salivary activity. So bacteria, they have a field day to do whatever damage you want to do. So that's why we recommend that before you go to bed, brush. Reduce the microbial activity in your mouth. Reduce the number of bacteria in your mouth before you go to bed.
Alright.
And then in the morning when you wake up, brush before you go out. Yeah. So
Okay.
twice.
Twice, okay.
Yeah, twice
Okay.
daily.
Okay, so doctor, the mouthwashes, that there should be fluoride in them, as this will aid properly when it comes to oral or dental hygiene. But recently, we've seen toothpaste and some mouthwashes that do not contain these ingredients called fluoride. So my question is fluoride in the toothpaste or mouthwash we are supposed to use a necessity? Like any toothpaste or mouthwash you're using, must fluoride be an ingredient in any of them?
And what other ingredients
Or
should we
what-
look out for?
Exactly.
I WHO still recommend that everybody brush with a fluoride containing toothpaste.
Okay.
Because the fluoride must be in your toothpaste.
Okay.
It must be because it's very, very beneficial. It helps to reduce bacterial activity. It does a lot of it's so beneficial to your tooth and not just yours, even to your bones.
Okay.
Yeah, fluoride and calcium, those two elements are very, very important to the strength of your tooth and your bones. Now, the reason why you have a lot of toothpaste without fluoride today is because when you talk about dental care,
Yeah.
it's not just the teeth we are talking about. Fluoride is very, very good for your teeth, but it may not be beneficial to your gums.
Oh, really?
It may not be not harmful to your gum.
Okay.
Fluoride is not harmful to your gum,
Okay.
but it may not do so much for your gum.
Why?
Now, like I said, fluoride and calcium, they are two elements that are very, very important
Okay.
for your teeth. It's just like potassium. Potassium is required in muscular activity.
Okay.
So your muscles generally need potassium to function adequately. Okay. Now, because dental care doesn't just refer to taking care of your teeth, there are other tissues involved, your tongue, your gums, and so that's the reason why we have a lot of toothpaste today that does not contain fluoride. Okay, those people, they have their own school of thought and their own reason for doing that.
Okay.
They just produce toothpaste without fluoride. And patients will tell you that, okay, I'm using this toothpaste, it helps with this, it helps with that, but what I do recommend, what I tell people is that brush with a fluoride containing toothpaste every day. If you must use a toothpaste that does not contain fluoride, you can combine it. Okay, you can use one in the morning, maybe the one that does not contain fluoride,
Okay.
that has elements that is very good for your gum, some herbal substances, hair, and then use the fluoride content at night. So that's what I tell my patients.
Okay, please let us know what causes tooth decay, because we've heard a lot of things. Some persons will tell you it's chocolate and sweet. Some persons will even tell you that their parents had tooth decay, so that's probably why. So tell us what causes tooth decay and tooth abscess.
Okay, tooth abscess is just a sequelae of tooth decay.
Okay.
When tooth decay is not taken care of, it progresses. From tooth decay, it progresses to what we call pulpitis. You know, a tooth has 3 components:
Okay.
the enamel, the dentin, and then the pulp.
Yes.
Before the alveolar bone that houses the tooth. So when the infection spreads from the enamel and it gets to the alveolar bone, that's when you have an abscess. Because from the alveolar bone, it tracks into the gum, then you have an abscess. Okay. But what causes tooth decay? Tooth decay is an infectious disease, meaning that it is caused by bacteria.
Okay.
It's caused by bacteria. When bacteria's activity becomes so much in the oral cavity, they proliferate, they multiply, probably because the deposits of glucose, of sugar on the tooth.
Okay.
You know, chocolate is sugar,
Yes.
biscuits, sugar. That's why we tell people when you eat any of these things, brush immediately.
So it's not hereditary.
It's not hereditary. What
Okay.
can be hereditary is your tooth size, the shape of your tooth, the shape of your jaw. Those things are hereditary.
Okay.
The size of your tooth, the shape of your tooth can be hereditary.
Okay.
But tooth decay in itself is more of environmental. Okay, that is what you eat, what you practice, your lifestyle.
Okay.
Do you understand? So when this bacterium becomes so much, their activity produces acid that dissolves the two substances. So when it dissolves the two substances, then you have a cavity.
Okay.
Do you understand? So you have a cavity. So when this cavity occurs and is not taken care of, the person refuses to see a dentist to fill it up. Okay, to fill it up, it progresses. From the enamel, it goes down to the dentin, to the pulp, then to the alveolar bone that houses it. Then you have an abscess.
Okay.
The person's face will swell. Okay.
So, doctor, when it comes to oral hygiene, how can someone take care of his or her teeth when it comes to dental work, such as filling or even braces that people do? And then how regularly should an individual change his or her toothbrush and tongue scraper?
Okay. First and foremost, for an individual to take care of your teeth properly, you need to know who to go and see in the first place.
Yeah.
To go and see. A lot of people who have toothache, they will go to a pharmacy.
Self-medication.
For self-medication.
The babalawos and the mamalawos.
Some will go to a chemist, some will even go to see a medical doctor. Well, a lot of them will refer you, please go to see a dentist.
Okay.
That's the actual person. Some will go to a spa.
Yes, that.
Some will go to a spa. They're having toothache, they'll go to a spa. Okay, now I'm digressing a little bit to dental quackery.
Yes, please.
Which is something major in this state and in Nigeria as a whole. So first and foremost, when you have toothache, go and see your dentist.
Not your spa.
Don't go to see a spa for toothache, or to do dental, to do scaling and polishing, or to do teeth whitening. Go to a dental clinic. Now it's in a dental clinic that you have all the practitioners of dental health. That's where you see them. They are trained for your tooth. That's a training they got in the university. The dental technologists, most of them have a HND. They are trained for your teeth, for your dental health. So first and foremost, to take care of, you need to know who to go and see. And the person you see is your dentist. Okay. Then regarding your you should change your brush every 3 months at the most.
Every
3 months, change your brush.
Okay.
Change your brush
Okay.
every 3 months. Then people have talked about keeping your brush. Well, most of the time we keep our brush in the bathroom.
Yes.
Let it not be so close to the water closet.
Okay.
Let's
Why?
bring a little bit. Okay, talk about hairborne infection.
Okay.
From especially those who don't take care of their toilet.
So
very well.
sometimes brushes come with the cover. Is it advisable to cover after use?
After
Or you
use,
let it dry before covering?
well, there's no.
Because some person just rinse and then cover it and keep
cover
it back.
Some don't even cover it.
Some don't even cover it.
I'm sure people that call their toothbrush, the percentage of those who are very, very, very few, very few. So you can just the most important thing is that wash your toothbrush, wash it very well. You can cover it immediately. You don't really have to let it dry. You can cover it immediately as long as you are the only one using that toothbrush. Then we don't advise that you share your toothbrush.
Okay.
You don't share it because when you brush, uh, your brush is going to take out some bacteria from your mouth. Some cells are going to be attached to that brush, and if another person uses it, it can be a medium of transfer of infection. You don't share your toothbrush, whether it's your twin brother, or it's your younger brother, or it's your husband.
There's no brotherhood
There's
in
no
this toothbrush.
No, you don't share your toothbrush.
All right.
And then there's what we call a dental floss. It's one of the things you use in taking care of your teeth.
Yeah, okay.
You floss daily,
Not toothpick.
not toothpick.
Okay,
You
okay,
floss daily.
okay.
And then when you use a floss, you discard it.
So it cannot be reused.
No, we don't recommend that you reuse it. Although some
Okay.
people say that, do you know how much I bought it? Do you know how much it flows? For example, take it, rinse it very well, and use
They're
it
quite
again.
pricey.
Yes, but ideally we don't recommend that you once you use it, because the same thing that applies to it also applies to it.
Yeah.
When you use a floss, it picks up cells, dead cells, bacteria,
Okay.
and germs. It
Okay.
picks it up, and then you wouldn't want to introduce that back to your mouth again. So, and then you don't share it too as well.
You don't share
You don't
dental
share
floss
it.
as
You
well.
don't share it.
Okay, so
And if you must reuse it, make sure you clean it very well
okay.
before you reuse it.
All right, so no toothpick, just dental floss. Okay, now let us know for scaling and polishing, when is the right time to come in for scaling and polishing? And does scaling and polishing and tooth whitening, does it work hand in hand? Again, tooth whitening, is it for everybody or just for some specific people, especially when it's your doctor who's recommending it, or you could just walk in and get a tooth whitening? And again, who is supposed to do a tooth whitening? Is it the spa owner or the dentist?
Like I said before, when it comes to your dental care, you go to a dental clinic.
Yeah.
You go to a dental, not a spa. It doesn't make sense that just because you saw a video on YouTube that now qualify you to do teeth whitening.
Okay.
A lot of spa officials, they've called me many times. Please come and teach us how to do this thing. Like, if you want to learn it, go and write JAMB again and go to the university and study it, because you watch a YouTube video doesn't qualify you to do the job of a dental therapist.
Okay.
So yes, scaling and polishing, we recommend you do it every 6 months.
Every 6 months.
Yes, that's one of the things that you will get in the dental care when you walk in.
Okay.
You see your dentist twice a year. So in the process, you do a scaling and polishing. Then teeth whitening is usually done based on recommendation.
Okay.
It's not. Why would you want to do teeth whitening for a child who still changing teeth, who has milk teeth? There's really no need for that.
Okay.
But you can do scaling and polishing for them.
Yeah.
Okay. Why do you want to do teeth whitening for a pregnant woman? In fact, scaling and polishing, sometimes you are careful. That's why when it comes to your dental care, just go to a dental clinic.
Okay. So visit your dentist today. That's what you're trying to say.
So today is a day to appreciate your dentist. If you have a dentist out there who has ever taken care of your teeth, give him a gift today. Appreciate him. Tell him thank you. It's not only when you have toothache that you will knock on the door of your dentist, or you call him very early in the morning. Dentist, I couldn't sleep last night, my teeth is paining me. Appreciate him today. Then also see your dentist every 6 months. And if you have dental care, the best place to go, the right place to go, is to see your dentist. Go to a dental clinic, not a spa.
All right. Thank you so much, Dr. Bimbo. I'll tell you something. I should have written an appreciation note for you to say thank you for the work you put in, but it escaped me. But I'm saying it with my mouth, verbally. Thank you so much for the job that you guys do. We truly appreciate. All right, we've been speaking extensively with Dr. Bimbo Akinuli, and he is the Principal Dental Officer of FMC, Federal Medical Center FMC Asaba, and we've been talking about dental care and everything you should know on the importance of taking care of your teeth. Don't go anywhere. When we come back, we'll be speaking with yet another guest. It's still Thursday's edition of Morning Ride. Thursday's edition of Morning Ride, and it's now time to take on another guest who is going to talk to us on the effect of the MORE agenda on youth in Delta State. With me here, I have Barrister Thank God Takrewe, Commissioner for Youth Development in Delta State. Good morning, sir.
Good
Welcome.
morning, Commissioners.
Welcome. All right, so please, you are having a crucial meeting with youth in Delta State. Can you fill us in about it and more on the essence as it relates to the MORE agenda?
Well, first of all, I want to thank God for this day. And, I remain Barrister Takrewe Harry Thank God, Commissioner for Youth Delta State. The youth in Delta State, they are all inclusive in the MORE agenda. I think our youth-friendly governor has specified this in numerous times concerning the youth. And in his administration, more than 80-something% or 90% of youth are part of the system. From SA to SSA, EAs, special advisors, commissioners, and other board members. And we all know the normal adage, we say, he who much is given, much is still expected. Today, 11:30, we are meeting with all the youths in the Ministry of Youth,
Okay.
from SA, SSA, EAs, special advisors.
That's all the youth officials.
All the youths that
Okay.
are appointees
Youth appointees, okay.
in the Ministry of Youth
Okay.
across the state.
Okay.
We are meeting with them today
All right.
to discuss the way forward. Just like I said, he who much is given, much is expected. They ought to be saying, doing what their appointment described them to.
Alright. Okay, at the beginning, the governor, when he was campaigning, he promised that he's going to be a youth-friendly governor. And I think he has achieved so much, but I'd like to know your thoughts. Do you think that more needs to be done? Because, he promised us more. So do you think more needs to be done? And again, your cap, I couldn't help but notice it. Youth, Isoko Youth Conference. Also let us know what that's about.
You see, just like I said, our youth-friendly governor is youth-friendly. And I think his number one priority is to see how the youth in Delta State are striving well. First of all, engaging them to become master of their own,
Okay.
to become employer of labor. I think through different NDAs, we've been able to demonstrate what is entailed concerning the MORE agenda for the youth.
Okay.
And in terms of this cap you see me with that I'm putting on now
Yeah.
is a conference that the SSA of youth in Isoko, they came together to see how they can able to reach out to the youth in their locals,
Okay.
of which I must applaud them for that big one they put together. It was not easy yesterday in the law campus. I think 70% of the youth in Isoko, they were all there. And also the guest speaker did well by expatiating on how they can able to benefit from the state government through empowerment in agriculture, how they can able to set up their own farms, that they shouldn't look at the way other persons are going the wrong way through the social vices and all those kind of stuffs, Yahoo and ritualists, robbery and all those kind of stuffs. But they should divert their attention to what will make their life meaningful and useful to themselves tomorrow. And I think it was a nice one, and I really want to commend the convener of that program. Nero Jr. is an SA youth, and Philip Oyenke and other persons who packaged that good life-changing program for the people of Isoko yesterday. It's a nice one. I commend them for that.
Okay, so Commissioner, sir, you talked about entrepreneurship and youth development. So what are the modalities that are put in place to ensure continuity when it comes to empowerment of youths in this state?
Just like I said earlier, like my ministry, it's an empowerment ministry.
Okay.
Create jobs for people, empowerment. We do other programs like RISA, TEP, and JEEP, which I've said here in this platform the other day. And also the Science and Tech is a platform which we can also empower our youth. Also job creations and other MDAs across the state. And I think many has been floated out already. And the youth are doing well in it. And if, based on what we've said in our meetings through the MDA's leaders, we met and we said there should be a follow-up with these persons that we've been empowering for these years to see how they can be able to carry 2 or 3 other persons along by employing them based on what the state government has provided for them. And in that, I think they're doing well. And the state government is still open for more opportunities that will be given to the youth.
Are there plans? Do you have more activities to engage the youths? Because I think they need more activities.
Just like I said, the programs are, I cannot keep mentioning them. We have more on the pipeline coming. Like Raisa, I said the other day. The memo has been approved already. In no due time, by next week, we are trying to set up the training camps for them. Tailoring, hairdressing, tiling, and other stuff like that. You understand? And what's it called? All those editing of programs, many things like that.
Okay. So, Commissioner, sir, you know the youth in Delta State is a large number that is comprised of those with special needs and those without special needs. So, also, what are some of the programs that are prepared for those with special needs in your ministry?
As you know, we no longer call them people with
disability.
Yes, so those with special needs.
I don't know if you've heard about, they have an organization in Delta State.
Yes.
For youth?
Yes.
For youth.
Okay.
You understand? Which we are not playing with them. We recognize them in every program.
Beautiful.
And even in an electionary process, they will say one special person with special needs should be part of it. So Delta State does not neglect those persons. They are part of us. They are part of the system. You know, but even their chairman, what's his name, is Shani Buzo. We relate one-on-one. Whatever anything that dues them, we always give them. You know, Bewu, there's one called Bewu, he's on which you know him.
Yes.
I think it's SSC.
Yeah.
I think I do.
To the governor. Many of them, like 40 or 60% are appointees. And in all our programs as well, they're also keyed into the program. So they're always be carried on.
Okay. This meeting that you're having, is the meeting going to extend to the grassroots? I mean, the one you're having in the ministry, is it going to extend to the grassroots where you're sensitizing these people to go spread the word? Is that the kind of program you're having?
Yes.
Okay.
The EAs, SSA, and the SAs in youth ministry. You know, we have a lot to do.
Yes.
And most of them, they have been docile with their activities. They've not been active the way we want them to be. And I think it is time for we to talk to them so they can be able to carry people in their ward, their units along. How to build bridges for tomorrow. Because if an appointment is given to you and the next door neighbor is not feeling the impact of what has been given to you, we should be frank here. Our youth-friendly governor cannot give the entire state an appointment. If a house has been given, it is trite that the next door neighbor should benefit from what his brother has
got in. Okay.
So they need to preach the gospel. They need to be seen doing what they're supposed to do. That is why we're calling this meeting in the party secretariat, in collaboration with the state party chairman. So we can be able to talk to them. So they should respect, one, authorities, and to do what is in their appointment later. Their youth mobilization, they should be seen mobilizing the youth in their areas. This is PDP state, this is not APC state.
Okay.
For keeping their appointments, they should be seen doing what they're supposed to do. Mobilizing the youth, bringing them informed. That is one of the major reasons why they've given appointment, and to reach out to the people in their locals that are not opportune to be SA or SSA or EA.
Okay. So when it comes to improvement of capacity, it's one thing to build capacity, and it's another thing over time to improve capacity. So how has the government, most especially, specifically rather, your ministry, improved on the already capacity of some youths in the states? Like, you find out that probably a youth is, let's say, already a teacher, a youth is already a medical doctor. So how has your ministry, like, taken advantage of these capacities already built to improve on them so that they can be beneficial to the society?
You know, there are a lot of seminars
Okay.
that the ministry and different entities in the states are organizing on leadership. And through those programs, they've been taught on how to build on their already established capacity, the one they have already, to build on it. I don't think our youth-friendly government has given anybody an appointment without the person having the capacity to fit in that position. Because if you identify from your ward or your unit to be an appointee, which means you must have the capacity to carry the people along, to lead them to the right path, in line with the more agenda. So the only way we think we can build on those capacity is through seminars, different seminars on leadership building that we set up, some in the States, some outside the States.
Okay. All right, Commissioner, sir, are there any challenges that your ministry might be facing at the moment? And then, do you think, because there's a saying that government is for me and you, are there external collaborators aside from the government, or do you accept collaborations from our external persons?
Yes. In the Ministry of Youth, we have a lot of people, NGOs, that are coming to collaborate with the youth.
Okay.
And some of them, when we go through their applications, it's a mind-blowing one. And we must key to their initiative to see how other persons who are not privileged to be in the ministry or in our own capture, as in what we've carved out for other persons.
Okay.
You understand? Yeah. So we always welcome those who want to partner with the Ministry of Youth.
Okay. Okay.
We've been giving out that hands from time.
Okay. All right. Okay.
Because we can't be, as in we cannot be there and here at the same time. Okay. So these NGOs and other persons who come to the ministry with these ideas, we welcome them.
Okay. All right. Thank you so much, sir. I'll say that you've done a lot talking to us, but I'm sure that we're going to have you here again because you told us a few weeks ago that you had your initiative that is still in the pipeline cooking. So I'm sure we'll have you here to talk more on that. Well, thank you so much. We appreciate the fact that you came here to talk to us about your ministry and how the more agenda would impact the lives of youths. So thank you so much.
Yeah, before I go, I want to talk to the appointees in Delta State.
Yes, please.
Under the youth ministry. That this meeting, that is compulsory for each and every one of you to attend this meeting, so that we can join hands together to move Delta State forward.
Okay.
Please don't sit at home that you are busy, you don't want to come. Because one of the reasons why you're giving appointments is for you to work and to show capacity of what has been given to you.
All right. Remind them the time and the day.
The time today, 6,
And venue.
and the venue is the party secretariat. And as you come, I
6
wish
p.m.
you. No, 11:30.
Okay, 11:30.
And as you come, I wish you safe journey. May the good God grant you safe
For
passage
the destination.
from your various destination.
All
Remain
right.
blessed.
Thank you so much, sir, for coming.
No problem.
All right, we've been speaking with Barrister Thank God Takrewe. He's a commissioner for youth development, and he's been talking to us on the effect of the More agenda on youths in Delta State. Thank you so much again, once
Thank you
again.
so much.
You're welcome.
All right, and that's why we'll call it a wrap on today's edition of Morning Ride. Your last words, Pepe.
Okay, today we had two commemorations that's got to do with three commemorations. One of them has got to do with oral hygiene. The other one has got to do with swelling in different parts of the body. To those I say, please do not self-medicate. If you find out that there's something wrong with you, please do well to go to the nearest health center or the nearest hospital so that you can be tested and checked. And also today is World Book Day. Please, for those of us that are finding it difficult to cultivate the habit of reading, it's never too late. You can start with a page, you can start with a line. Like Chizzy said, even though you sleep on it, at least it's progress. Even when we don't count progress, we are making progress. So get a book today, read, be informed, and also enrich your mind. Thank you.
All right, from me, I want to give a special shout out to our supervising producer in person of Nimi Bofa Ozibo and our producer Vivian Nkechika, the man behind the MCR, Alex Afodu, the cameraman that make things happen, Eunice Aporubaro. And from me, all I have to say is today's World Dentist Day. I appreciate your dentist and see a dentist today. Remember that Delta State is for me and you. So if you see something, do say something. I'm Chizzy Awuno. We'll begin again tomorrow at 7 a.m. bright and early on the set. God bless Nigeria and God bless Delta State.